Hi, I'm Dr. Randy Bach. Today's August 31, 2022, and I'm going to do some coronavirus conversing for our coronavirus conversation, our millionth episode to date. I have a short time frame, and that's probably a good thing, so you get to hear me speak less, probably. I'm going to just kind of graze over some things I've been looking at. I have two pieces coming out shortly, I believe, at brownstone.org. So keep your eyes peeled for those. It's a great site anyway. I recommend you look at it. They've been tried and true all along. They have excellent people writing, and they present a skeptical viewpoint of a lot of things that have happened for COVID in terms of the overreaction and the political shenanigans and political opportunities taken, and kind of the overall disdain for the populace. I'm going to try to get into some of that. I think the major thrust of the article that I'm going to be publishing soon is that if you saw last week's show, you can hear this, but I'll tell you again anyway, that Omicron 22B, Omicron BA.5, I think it's called, or we call it Omicron. I think it's the third version of Omicron, is not physically related to the COVID-19 lineage. The earlier strains, second wave, the alpha, beta, gamma, delta, kappa, so forth. Prominent ones were the beta and the delta, I believe, or the alpha, beta, and delta, were physically related. They were descendants genomically of COVID-19, SARS CoV-2, but Omicron is not, and it should not be taken as such. This is really in accord with the occurrence of the coronavirus common cold, which we don't hear about much anymore. But it's if you go to any textbook from 2017, 2018, or before, and look up coronavirus, and they still have certain textbooks in paper, so those are good because they don't get updated and kind of bowdlerized and shenaniganed. You'll find it says specifically coronavirus is a respiratory virus associated with common cold. It's the second leading cause by type for the common cold, with a few other types here and there. I think it's adenovirus and rhinovirus and so forth. But without getting into specifics, that's what coronavirus has always been. And probably they migrated from the wild coronaviruses that affect other animals, such as the SARS 2003 version did. So this is nothing to be concerned about. There should not be a vaccine for this. Pfizer is coming out with one. And I think the real linchpin for all this is the emergency use authorization. So if you want to get political about this and do something, you should try to write your congressman about discontinuing the emergency use authorization. There is no longer an emergency regarding coronavirus. If in fact, we are just testing because we test, and we have a test that overlaps with the common cold coronaviruses, such as Omicron is, and the SARS-CoV-2 type, such as ancestral 2020 version and the 2021 second wave strains. So, if we had not had COVID-19 as an epidemic, we would not have the coronavirus testing right now. We would not be even thinking about Omicron as anything. We wouldn't even have a Greek letter for it. We wouldn't call it anything but a common cold. Historically, we've never subtyped or tested or quarantined or worn masks for the common cold. That's what Omicron is. Omicron is a common cold. Common colds have always been coronaviruses in part, and that's what that is. It's not a SARS-CoV-2. It's not related. It's not the severe thing. All the stuff about long COVID and all that kind of stuff, you can kind of drop that. Insofar as the common cold has ever caused long-term symptoms, so can this one. That is to say, if you are physically impaired, you're on your last mile. Rest in peace, Mikhail Gorbachev. But if he had gotten an Omicron, say 2 weeks ago, and he's 91 years old, that could easily tip him over. So I'm not trying to minimize this for people who are sick or immunocompromised or whatever. You should always have cautions, but those do not pertain to 98, 99% of the population, especially those who are active and running around. I was in Trader Joe's, which was probably over the weekend, and I don't usually go, but wife was going, so I went in. And for me, it's not just shopping, but sociology. I had been at a Catholic mass, and I'm not Catholic, but my mother-in-law passed in April, And such as COVID has made things kind of like asynchronous with the events. So we don't necessarily do funerals right away as much, but we had an event in Canada for her, kind of a memorial event. We had one at a parish in a working class area, I guess northwest of Portland, Maine. And to their credit, I mean the population at the church, there were a few hundred people there. Like at most religious congregations, it skews elderly, and I would say the median age was about 70. And I swear to God that there were maybe only 2 people in the whole place out of maybe 200 people that were wearing masks, and they were not the oldest, and they're welcome to wear one. But I think everyone had kind of had the sanity beat back into them that this is nothing to be concerned about. They all left, and I'm sure they're not having any outbreak. You can check Portland, Maine. I don't think anything's happening, but there are still people fearful. I go to a congregation, and I'm an officer, and I get kind of involved in certain discussions. They've been heated over the years. I've been the no mask variety. People are still super cautious. We have a member who is Master of Public Health and works in concert with the Massachusetts Department of Public Health, and he's super gung ho on super masking and super exclusion and so forth. And it obviously represents an absurdity, because I mentioned on previous episode I had been at a separate funeral at a Methodist church a few weeks ago, and in the sanctuary everyone's all masked up. The dining function hall, more crowded. People are facing each other, and everyone's unmasked because they have to eat their sandwiches, croissants, and muffins. It makes no sense. How do we know it makes no sense? Because almost we're told this. I guess it came out of one of the Florida school shootings. David Hogg received prominence, and he's such a big hog. It's actually 2 G's for his name, and he made it to Harvard and so forth. And he's been a darling of the left. And he admitted, I think in last year, he said, I think wearing a mask is a small price to pay because it shows my politics. I wouldn't want to be not wearing one and be thought of as not a leftist, not a Democrat. He probably said that a little bit differently, but basically, masks have been political all along. They are still a social signifier. So getting back to Trader Joe's, as compared to the Catholic Mass of 200 people, it was probably more sparsely distributed because people are sitting, side by side in the pews at the church. And the Trader Joe's, they have a big store and people are kind of milling around. They're not really next to each other. But there were a fair number of, let it grow out hair-wise, Cambridge types, we'll call them. Ann Arbor, Cambridge, Berkeley, bumper stickered cars, and so forth. People, and I'm sorry to generalize, I apologize how that sounds, but that is actually literally the case in certain of these. They are, in their 30s and 40s, and they're strapping on the over-the-head N95s, not just around the ears. It's going to be full, and it's going to be completely, occlusive, not cognizant for their faces, a little bit antisocial, asocial, and milling about the store and so forth. Silly. There was no rule at Trader Joe's. Some of the clerks had them. Some of them didn't. There was no real age distribution, obvious. A lot of young people had masks. There were some 4-year-olds with masks for their parents, and there were some 80-year-olds without. There you have it. I don't know what to say about that, but it's become a silliness. And right now, this is a common cold. So when my article comes out, I hope you share it. I'll try to give you a heads up. But you can pass the word around to look at last week's video. If you want a sneak peek at the article, I'm happy to do that as well. But basically, the Omicron is at least an order of magnitude or more less lethal, less deadly than SARS CoV-2, and there you have it. And mind you, the variant, second wave variants were less lethal as well, but they were both, they were all more lethal than the Omicron, which is the mildest all along. The fact that Omicron is even a thing that we talk about is an absurdity. I think if the last presidential election had gone differently, this would have been long past. I think the fact that it remains is political. It is, coronavirus election season coming up. And I think getting back to my main point about the emergency use authorization, it remains in place, I think, for a couple of reasons. It's not that coronavirus is a danger. It's back to being the common cold coronavirus, but yet we still have the emergency use authorization. This keeps as an umbrella in a way of clearing inventory for the Moderna/Pfizer and to a certain extent J&J vaccines that are out and about. They no longer have any real place in the armamentarium against the common cold, Omicron, nor should they. And insofar as they ever did have a use, it was early on, and as the viruses mutated away and transformed their own appearances from the spike protein of the ancestral 2019-2020 version, they had less and less use. So all we ever hear about boosters is really a misnomer. There's no such thing as a booster when you're having a vaccine that's 3 years out of date. There are no breakthrough cases because people are not breaking through their previous COVID-19 vaccine when they're getting an unrelated coronavirus, common cold coronavirus. But the emergency use authorization maintains itself and pertains politically because it allows the government and Pfizer and so forth, and Pfizer and Moderna are going to make money, but you can rest assured that a lot of it's going to filter back to politicians who favor them, and there's a lot of money, so that they're able to kind of we'll say sell. It's kind of a weird way of selling. They're almost enforced sales that people were mandated in certain professions and so forth. And even to get the proposed modified Omicron / COVID-19 vaccine, there's some statutes proposed that you kind of have to get up to date and have had 4 previous COVID-19 shots, say 3 of them unnecessary, and certainly unnecessary after it's all gone. And that's going to be mixed in. So that's going to be a preliminary. You're going to have to get up to date with your previous COVID-19s before you can get the Omicron one / COVID-19. And the COVID-19 part of it is immaterial, irrelevant, antiquated, useless, and potentially dangerous. And the Omicron is pointless because Omicron is a common cold. But as long as this EUA gets carried on, it's a little like a game of tag. And now the tag is on Omicron as some kind of death agent. And I think a lot of the numbers have been exaggerated with Omicron because there are I don't think there's any great overall increase in mortality versus baseline from prior years from 2018 currently. So people die. That is a fact of life. Unfortunately, none of us want to think about it. It happens to everybody. And but insofar as people are dying, with Omicron diagnosis, I don't think that's necessarily pertinent. The death numbers are way down in Europe compared to here. Why are they higher here? I think there are and have been incentives all along for COVID-19 diagnosis for the hospitals to get more money. People have had and been mistreated by those incentives because people have been funneled into ventilators and so forth early on when that was not necessarily the right treatment. But the hospital would get $13,000 extra to be put on have somebody put on a ventilator, and maybe CPAP would have been enough. Kind of standard sleep apnea, mask, mild, gentle, without intubation. But there you have it. I think one of my cohort in a group I'm in, pandata.org, mentioned that disease of unknown origin seems to be on the rise, and there's an open question about that, whether it's vaccine related. So there have been a lot of mysteries regarding vaccination. I don't think there would have been to the same extent if it had been left to people's own devices, for the people to decide on their own whether they feel at risk for such an issue or they want to volunteer themselves. But the mandates were always absurd. Having children vaccinated at all for coronavirus, COVID-19 even, was idiotic because they really have never been at any risk. And healthy children across the board have had, I think, a total of 0 cases of mortality in the United States for the duration. Anyway, so let's see if I can get to some of the things I've been looking at. I apologize again. I'm going to breeze along. Maybe I spent too much time talking, but I'm going to just kind of show you, I guess, in brief, a few things that I've been looking at lately. I'm not sure we can pronounce this. Eugippius, he's a has Substack and eugippius.com. I think it's well worth reading him. A very good data analysis, and he's got things coming out on a regular basis. So here's his name if you want to see it a little more clearly. But this is an article I was looking at, the earliest days of the Italian pandemic, or why nobody wants to look at the early data. This is before lockdowns. And basic point of this, you can kind of see in the graph, these are the various provinces or cities. I think maybe this is Bergamo, Milan, Padova. I'm just guessing at some of these, but yeah, the different regions of Lombardy. So that's all Milan area. So this is probably Bergamo. That's probably Milan. Anyway, in all cases, the numbers in Bergamo was hit early on most. The numbers were already going down before lockdowns were put into place. So this is a very interesting point. And again, the dates are down here. So before anybody ever thought of lockdowns, the R factor of transmission, which is kind of the holy grail for epidemiologists, was already decreasing. Why is that? Well, because A, immunity is occurring, and B, people are not insensate beings. They're not, I don't know, beads or a necklace or something like that. They move around themselves. So they make their own measures, and they take on their own decisions, and they stay away from people who have sniffles and so forth. This is the reason basically that Ebola has never kind of taken off, although the epidemiologists predict it, because people react to somebody who's ill. So Ebola causes such illness that people stay away. Early COVID, this is probably happening as well. So I'm not going to get too far into the weeds with this, but I do recommend his site in general. I think it's useful, and you take a look at it. I like the Spectator, and these are just kind of look backs. What we were always hearing about, the hospitals are going to be overrun. So the NHS is English. That's the socialized medicine. And I don't think they're run as well as we are here privately. But even so, was the NHS overrun by COVID during lockdown? And long story short is no. Was never deluged by their own measures and so forth. So a lot of the things that we, kind of had continued lockdowns and draconian over and over again, these were probably overkill. What else? This is an interesting page here, the ethical skeptic. China's CCP concealed SARS CoV-2 presence in China as far back as March 2018. I have not had, this is posted last year, I have not had much chance to look over this data. I don't think that's necessarily shocking or surprising. They did have SARS CoV-1. It's kind of like World War I. It was called the Great War at the time. Nobody called SARS CoV-1 that. It was just called SARS. And it's only after the second one came around that we call the other one CoV-1. But it's not impossible that there were leaks from the laboratory. I don't think it was run that well. I think there were outbreaks in 2019. But this is an article that is interesting because I don't think our Chinese brethren politically there were completely forthright with us. What else? This is, again, I'm kind of skipping along. This is kind of a sad one here. This is by Dr. Paul Alexander, interesting guy. Sedatives were prescribed at 100% higher rate during early COVID. Care homes have been accused of using powerful sedatives to make coronavirus victims die more quickly. This is just not, I don't think this overall has been our finest hour. This is kind of a corroboration article here. This is August 28th. Do not resuscitate orders. Hospitals decide our parents' and grandparents' lives without informing us. It's interesting, just for the full disclosure, Dr. Paul Alexander, the way he gets categorized, if you Google him, he's a researcher and epidemiologist. And I guess he's a psychiatrist as well. Maybe that's a different guy. I can't tell. But at any rate, HHS science advisor Paul Alexander called for millions of Americans to be infected as a means of fighting COVID-19. So Politico takes that up, and that's an interesting point. I'm sure he's being somewhat misquoted. I just want to point out, I mean, historically, I haven't had a chance fully to look at this article, but here, this is what he actually says. So it's not all Americans. It's infants, kids, teens, young people, young adults, middle-aged with no conditions have zero to little risk. So we use them to develop herd immunity. We want them infected. I don't think that's controversial. I think it's controversial the way people have acted. It may be that it will be best if we open up and flood the zone and let the kids and the young folk get infected in order to get natural immunity, natural exposure. I wrote in July to the FDA. They acted probably like Invasion of the Body Snatchers and screamed and yelled at him. I think this is very reasonable. There was enough data from the Diamond Princess and the months thereafter to determine that children were at zero risk and healthy people as well. And for them, it was on the equivalent of, probably less than influenza with a vaccine. So you get somewhat sick, but not horribly so. I don't know if I'm going to have really time to go into many more of these, but there are. I think just as far as recommendations, I like Steve Kirsch's Substack. He's a computer guy, but he's taken an interest in this, and he's helped support some good data analyses. You can read his article and judge and decide. I have not read it in full. I don't think the vaccine has been vastly deadly, but I think it has been, any deaths that occur from it after the acute phase of ancestral COVID-19 are pointless because they should not have been given. The vaccine, again, getting back to the emergency use authorization, if we take that away, or if we call the emergency, let's say we didn't know enough in 2020 and we did lockdowns, they were wrong, they were overkill. We did masks, they were probably pointless and so forth. We tried to, keep the hospitals, underused and so forth, probably pointless. And we did a lot of things that were pointless, overkill, and now we're paying for it with inflation and kind of a deteriorating society, all that kind of stuff. Fine. Was there any point to continue the emergency part of that the subsequent year? No. Is there any point to continue it now? No. Insofar as it's happening that way, it's being used as a political vehicle and a pharmaceutical vehicle. I'm probably going to call it a day as far as this goes. Anyway, if you have any thoughts and comments on that, please let me know. Share this at will. I'd love to talk with you. The agreement, disagreement, however you like. I do have my Zika book out. I have a copy of it over there. Too far away to show you, but it's Overturning Zika. It's available on Amazon. I have I'm doing a Portuguese, Brazilian rollout as we speak. If you know people who would be interested in hearing about this, let me know. The last great pandemic probably never should have been either. Although they're very different. Zika microcephaly is for a mosquito, and I think there was a lot of misinformation early on. Coronavirus is a real thing. COVID-19 is a real virus. It does cause real problems for certain people, but again, skewed elderly and so forth. The entire population should not have been kind of victimized by some of the overkill, almost literally in this case. So we will have a lot of societal kind of blowback, and you just have to be smart about this and figure things out and just try to remember who told you the truth and who didn't. I'm going to call it a day. Thanks so much for joining us, Dr. Randy Bach. And again, the book is Overturning Zika. You can find it on Amazon. And any questions or interest in that, or know people who'd want to interview me on that topic, I'd be happy to talk with them as well. So have